Welcome, curious minds, to another deep dive. Today, we're getting into something pretty critical for livestock and farmers: vesicular stomatitis in cattle. You've sent over a stack of really interesting sources, and well, our mission, like always, is to unpack it all and pull out the key takeaways for you. And right off the bat, there are two really crucial things here. First, vesicular stomatitis, VS, it's, not usually fatal, but its economic impact is huge. We're talking lost production, trade getting shut down, and maybe even more important, its symptoms look almost exactly like foot and mouth disease.
Which is a really serious foreign animal disease, highly contagious.
Exactly. So getting a fast, accurate diagnosis isn't just important, it's vital for national biosecurity. So yeah, let's get ready to unpack this whole thing from the tiny virus itself to the much bigger picture. Okay, so let's start right there. What exactly is vesicular stomatitis? What does it do?
Right. So vesicular stomatitis is a viral disease. It's caused mostly by the vesicular stomatitis virus, VSV. Mainly you hear about the New Jersey and Indiana serotypes, but there are others too, like Cocoa aligois.
And what does it actually do to the animal?
It causes a fever, and then these painful blisters, vesicles we call them. They pop pretty quickly and turn into ulcers.
Ouch. Where do those usually show up?
Typically in the mouth area, so tongue, lips, nostrils. But you can also see them on teats, udders, even around the hooves.
So painful, but not usually deadly.
Generally, yes. Low mortality rate. But the economic hit is significant. Productivity drops. Trade gets restricted.
And which animals are we talking about? Cattle, mostly.
Cattle, definitely.
Yeah.
Horses, too. And swine. Sometimes sheep, goats, llamas, alpacas, even some wildlife can get it. And what's kind of fascinating, scientifically speaking, is the virus itself, its structure, how it adapts.
Oh, so?
Well, it's an RNA virus. It's enveloped. And it has this very distinct bullet shape under the microscope.
Huh. Bullet-shaped?
Yeah. And its genetic code, it's RNA, it's what we call plastic. Replication isn't perfect. Lots of errors happen.
Which means lots of variations. It changes easily.
Exactly. It generates diverse variants really quickly, so it can adapt fast.
So this genetic plasticity you mentioned, that sounds like it makes things tricky. Like for vaccines, does it mean a vaccine might not work for long?
That's a huge challenge, yeah. It definitely impacts how effective control measures are long term. Vaccines might become less effective over time.
And diagnostic tests, too, I guess. They'd need updating.
Constantly. It means you need ongoing surveillance, flexible diagnostics, flexible vaccine strategies. It's not a static target. And, down at the cellular level, this virus is just nasty. It basically shuts down the host cell's functions.
How does it do that?
It suppresses gene expression, messes with the cell's internal structure, the cytoskeleton. It leads to really rapid, widespread tissue destruction. Cellular cytolysis, we call it.
And that's why you get those severe blisters popping up so quickly.
Precisely. That cellular damage explains those acute, very painful vesicular lesions.
Okay, that explains the what. Now, how does it actually spread? How does it get from A to B into a herd?
The biggest culprits, the primary way it gets introduced, we think, is through biting insects.
Like what kind? Mosquitoes.
More like black flies, sandflies, biting midges, culicoids. They seem to be the main vectors bringing it into domestic animal populations.
So the insects kind of open the door. But once it's in a herd, can animals spread it directly?
Oh, absolutely. Once it's there, direct contact is a factor. Saliva, fluid from those ruptured blisters that can spread it.
What about like water troughs or equipment?
Yep, contaminated objects, fomites we call them. Feed, water sources, milking machines, any shared equipment can carry the virus. Usually needs a little break in the skin or the mouth lining to get in, though. Intact skin is pretty resistant.
Does it get into the bloodstream and spread that way?
Not typically in livestock, interestingly. We rarely find widespread virus in the blood viremia. It seems to stay more localized. Often, it doesn't get past the local lymph nodes. So the main source for spreading it further is the virus shedding directly from those lesions. And if you zoom out, look at the history and where this pops up geographically, it tells you a lot about its link to the environment.
Right. You mentioned serotypes earlier. Has it been around a long time?
Oh, yeah. Clinical reports go way back into the 1800s. The virus itself was first isolated in 1925. It's basically the most common vesicular disease across the Americas, and it has a pretty clear seasonal pattern.
More common in warmer months?
Exactly. It's an endemic, meaning it's always kind of present in places like the southeastern U.S., southern Mexico, Central America, northern South America. From those warmer tropical, subtropical areas, it can then cause these sporadic outbreaks, epidemics in more temperate places during the summer.
Are there similar viruses elsewhere?
There are, yeah. Related vesicular viruses are endemic in parts of India and Africa, too.
That strong environmental link makes you wonder, how predictable is it? And, I mean, with climate change, could that make things worse or change where it shows up?
That is a huge area of current research and concern. Studies, especially in the western U.S., show its distribution is tied to things like rainfall patterns, summer and winter, so winter temperatures, elevation, how much vegetation there is in the fall, even horse density, and how close farms are to water sources.
So it's complex, but there are definite environmental drivers.
Absolutely. These aren't just random correlations, they seem to be fundamental drivers of spread. Understanding them is key for building models to predict outbreaks.
Which would help with targeting surveillance and maybe getting ahead of it.
That's the goal. Targeted surveillance, preemptive control. And, historically, this is a big deal for trade. VS used to be a List A disease for the OIE, the World Organization for Animal Health.
Meaning automatic trade restrictions.
Pretty much. Mandatory international reporting, really strict restrictions. It's been reclassified now as one of many listed diseases.
But it still causes trade problems.
Oh, definitely. Even without that top-tier classification, outbreaks still lead to significant economic losses because of restrictions on animal movement and international trade.
So we've talked cattle, horses, swine. Who else is on the list? And what about people? Can we get it?
Well, the main ones are definitely horses and cattle. Equids, horses, mules, donkeys, and cattle. But yeah, swine, sheep, goats, llamas, alpacas can get it too, although often the signs are pretty mild or even unnoticeable in sheep and goats.
And you mentioned horses. Is there something unique there?
There is actually. VS is the only vesicular disease, meaning blister-causing disease, that naturally affects horses. It's a key point.
Okay. And the human question.
Yes, humans can get it. It's zoonotic.
How would someone typically catch it? Working with sick animals?
Usually, yeah. Direct contact with the lesions or saliva, nasal secretions from an infected animal. Lab exposure is also a risk if you're working with the virus directly.
What does it look like in people? Is it serious?
Generally, it shows up like a bad flu. Fever, muscle aches, headache, just feeling generally unwell, malaise. It's typically not fatal in humans, but it's definitely unpleasant, can knock you out for a bit, cause lost work days.
So a real occupational hazard for vets, farm workers, anyone handling livestock.
Absolutely. It really underscores the need for good biosecurity, wearing gloves, maybe face shields, gowns when you're handling suspect animals. PPE is crucial to reduce that risk.
Okay, so let's picture a farmer looking at their cow. What are the specific signs? What do they actually see if an animal gets VS?
Well, after exposure, it usually takes about 2 to 8 days for signs to show up. That's the incubation period.
Yeah.
Often the very first thing you might notice is just excessive drooling, lots of saliva.
Because of mouth pain.
Exactly. A fever might pop up too, maybe just before or right when the lesions appear.
And the lesions themselves, you said blisters that turn into ulcers.
Yeah, they start as these kind of pale, raised blisters, vesicles, but they break really quickly, leaving raw spots, erosions, or ulcers.
And where exactly would you look for those?
The mouth is prime territory. Inner lips, gums, the tongue, the dental pad, also the nose. On bulls or steers, the sheath. On cows, the udder and teats. Sometimes even the ears or right around the hooves at the coronary band.
Sounds painful.
Extremely painful. So the animals are often reluctant to eat or drink. They can lose weight. If the feet are involved, they'll be lame.
And for dairy cows, those teat lesions must be a nightmare.
Huge problem. They very often lead to secondary bacterial mastitis, and milk production just plummets. It's a major issue. If you were to look at the tissue microscopically, you'd see that breakdown we talked about, the skin layers blistering, filled with fluid and immune cells. Just shows the damage.
But it does clear up on its own eventually.
Usually, yes. It's generally self-limiting. Most animals recover fully within, say, 1 to 5 weeks. But it's crucial to grasp how that pain directly impacts the animal, even if it recovers. Not eating means weight loss.
Right.
And in dairy cows, that link between the teat sores, mastitis, and lost milk, that's a double whammy for welfare and the farmer's bottom line.
Okay, this is where it gets really critical, right? The diagnosis part. Why is it so important to nail down if it's VS, especially with those look-alike symptoms?
Because, clinically, you just cannot tell the difference between VS and foot and mouth disease, FMD, in cattle. They look identical.
And FMD is the one we really don't want here.
Exactly. FMD is incredibly contagious, devastating economically. The U.S. has been free of it since 1929, and a reintroduction would be catastrophic.
So just looking at the cow isn't enough. You absolutely need lab tests.
Absolutely.
Yeah.
Cannot stress that enough. You cannot make a definitive diagnosis based on clinical signs alone. Any animal showing vesicular signs, especially cattle, must be treated as a potential FMD case until the lab proves otherwise.
Wow, okay. Besides FMD, are there other things that might look similar, other diseases to rule out?
Yeah, there's a list. Bovine papular stomatitis causes mouth lesions,
Yeah.
but not usually on the feet. Bovine viral diarrhea, BVD, can have oral lesions, but you'll likely see diarrhea or respiratory signs too.
Yeah.
Infectious bovine rhinotracheitis, IBR, mainly respiratory. Malignant catarrhal fever is much more severe, usually fatal, causes bloody diarrhea, inflammation. Blue tongue can sometimes cause mouth or teat lesions and lameness, but often it's milder in cattle.
What about non-disease things, like injuries?
Right. You have to consider simple things like physical trauma to the mouth, maybe chemical or thermal burns, even things like photosensitization or certain plant toxicities, though they usually affect the skin more broadly. And for lameness, you rule out things like foot trot or hoof abscesses, which wouldn't have the mouth lesions. So the urgency for lab confirmation isn't just about that one sick animal. It's truly about national biosecurity, protecting the entire industry, maintaining trade.
Which means getting good samples to the lab is paramount.
Absolutely critical. You need the right samples. Fluid from those blisters, if you can get them before they rupture, or tissue from the edge of a fresh rupture. Epithelial flaps. Swabs work too.
Is it hard to collect those?
It can be. The mouth lesions are painful. Sedation is often recommended for everyone's safety. Then you need the right transport medium. Keep it cold ice packs for short trips, dry ice if it'll take longer than a couple of days.
What if there are no fresh lesions?
Then you might try collecting fluid from the back of the throat, like an esophageal, pharyngeal, or OP sample. Or you take blood serum samples, one early, one a week or two later, to look for antibodies rising.
So once those samples reach the lab, what are the main tests they run?
Broadly, they're trying to either find the virus itself or find antibodies the animal made against it.
Okay, finding the virus first.
Right. The classic way is virus isolation, trying to grow the virus in cell cultures. It works, but it's slow, can take up to a week, and sometimes samples get contaminated.
Faster methods.
Definitely. RT-PCR, reverse transcription polymerase chain reaction. That detects the virus's genetic material, its RNA. Much faster, often results within a day. There's also ELISA, specifically an indirect sandwich ELISA here. That looks for viral proteins, the antigen. It's usually the quickest and least expensive way to spot the virus itself.
And what about detecting antibodies, showing the animal was exposed?
There are several tests for that, too. A competitive ELISA, or SELISA, is common, especially for trade testing. It's a one-day test. Animals can test positive on that for years after infection. Complement fixation, or CF, is another trade test. Also takes about a day. It tends to detect more recent infection, positive for maybe weeks or months. And virus neutralization, VN or SN, that takes a bit longer, 2-3 days. Like the ELISA, animals can stay positive for years.
So multiple options on both sides.
Yes, and because antibodies take time to develop, but the virus might only be shed for a short window, the best approach is usually to collect both types of samples if you can, samples for virus detection and blood for antibody testing, especially from animals that are clearly sick.
Okay, so we've diagnosed it. It is VS, not FMD, thankfully. What's the treatment plan? Is there a cure?
Unfortunately, no. There's no specific antiviral drug that cures VS. Treatment is really about supportive care, making the animal comfortable.
How do you do that?
Primarily managing the pain, using anti-inflammatory drugs like flunixin, making sure they keep eating and drinking, maybe offering softer feeds so the mouth sores don't hurt as much, monitoring to prevent dehydration or severe weight loss.
What about antibiotics?
Only if those sores get a secondary bacterial infection. Antibiotics don't touch the virus itself.
But the outlook is generally okay. They get better.
Generally good, yes. Most recover on their own within a few weeks, which really shifts the focus, doesn't it? If there's no cure, then prevention and control become absolutely everything.
How does that work? What are the main control strategies?
First off, it's a reportable disease. You suspect VS, you must report it immediately to your state vet or federal animal health officials. That triggers the response.
Which usually involves quarantine.
Typically, yes. Effective farms get quarantined usually for at least 14 days after the last animal shows healed lesions. Strict movement restrictions on and off the premises. And within the farm, isolating the sick animals from the healthy ones is key. Stabling them separately is often recommended.
And basic hygiene, I assume?
Crucial. People handling animals should always care for the healthy ones before dealing with the sick ones. And strict cleaning and disinfection between animals.
Given the insect role, vector control must be high on the list too.
Absolutely vital. reducing breeding grounds for those flies and midges. So managing manure, eliminating stagnant water, muddy areas, using approved insecticides or repellents on the animals or premises.
Does keeping them inside help?
Bringing animals indoors, especially during peak insect activity times like dawn and dusk or even overnight, can definitely help reduce exposure. And then general biosecurity, disinfecting boots, hands, clothing after handling sick animals, not sharing equipment between sick and healthy groups, or thoroughly disinfecting if you must.
Does regular disinfectant work?
Sunlight is actually pretty good at killing the virus. But yes, standard disinfectants like diluted chlorine bleach are effective. And of course, those movement restrictions are key, especially for animals moving internationally. There are specific testing and certification requirements.
What about vaccination? Is that an option?
In the U.S., there isn't a commercially available vaccine for routine use in cattle right now. Some vaccines might exist for emergency use or are used in other countries, but it's not a standard tool here.
So it really comes down to biosecurity and vigilance.
That's the cornerstone. Integrated biosecurity, vector control, prompt reporting, movement control. Since we lack widespread vaccines, these non-drug interventions are absolutely crucial.
We've touched on the economic side a few times. Let's dig into that. Despite not being a huge killer, you said the economic losses are significant. What are the main drivers of that cost for producers?
Yeah, the costs add up quickly. First, you have direct production losses. Milk yield drops dramatically in dairy cows, like we said. Beef cattle lose weight or don't gain properly.
So less product to sell.
Exactly. Then there's the massive impact of trade restrictions. This is often the biggest single factor.
How so?
An outbreak leads to quarantines. That stops animals moving off the farm. But it also triggers restrictions from other states or countries on importing live animals, meat, milk, even semen or embryos from affected regions. Market access just shuts down.
And the quarantine itself costs money.
Right. Normal operations stop or are severely limited. That's lost productivity right there. Plus the extra labor and costs of managing the quarantine itself. And finally, you've got the direct veterinary costs, the vet visits, the pain meds, maybe antibiotics for secondary infections, plus the ongoing costs of implementing all those biosecurity measures. Insect control, disinfectants, maybe changing management practices. So yeah, it's this interesting situation where the low death rate kind of hides the real financial hit. It's the sickness, the lost production, and especially those market access issues that drive the economic damage. It really underscores why preventing it is so critical.
Okay, so pulling this all together, we've really dug into vesicular stomatitis. We've seen it's this bullet-shaped virus, often spread by insects initially, causes those painful blisters, making it look alarmingly like foot and mouth disease, which is why quick lab diagnosis is non-negotiable. And even though it doesn't kill many animals, its economic punch is severe, hitting production, yes, but maybe hitting trade access even harder. It really seems like managing this needs that integrated approach you talked about: strict biosecurity on farms, understanding the environmental factors, vector control, and dealing with the virus's ability to change.
Absolutely. And that leads to a really important question to think about, especially looking forward. We know this virus adapts. We know it's linked to environmental factors, climate, seasonal patterns. So the question for you is, how might our changing global climate complicate things further? Could we see VS showing up in new places, spreading differently? What new challenges might that pose for controlling outbreaks, for livestock trade, maybe even for food security down the line?
That's definitely something to chew on, a powerful thought. Thank you for joining us on this deep dive. We hope you feel a bit more informed, maybe a bit more curious too, about this complex world of animal health and its really global impact. Until next time.